Back when I first started, there was a lot of people I spoke to that had a pension. They had a pension from their employer. I worked in the same business, same company for 30 years. And I have a pension now. They don't today. So times are different and people are just having to work longer.
Medicare Advantage versus Medicare Sup. Which one is the best fit for customers? That's exactly what we're going to dive into today. What questions should you be asking customers? What prospecting methods actually work? We're going to dive into this with Neil Reich with Care Connect Advisors. He has over 30 years of experience, and he's going to share with you everything that he knows to help you be more successful in helping more customers out with their Medicare plans. With that being said, let's start the show. Hey, welcome to the Insurance Buzz. We are your hosts, Michael and Courtney Weaver. And today we have a very special guest, Neil Reich, and we are going to be breaking down everything you need to know about Medicare season and helping your customers. Neil, welcome to the Buzz.
Thanks for having me. So it's an honor and a pleasure to be here. So thanks for inviting me to your show today.
Absolutely. We're super excited. So, if you've never listened to the Buzz, Neil, which I don't expect you to, we like to get straight into things. So I'm going to go ahead and just have you talk just a little bit about your experience in the industry, just so our audience knows who's going to be answering questions. So tell us a little bit about yourself, how long you've been in the industry, and your success.
Sure. So I've had my insurance license, dating myself for a little bit. So I got my insurance license in 1990. So I've had it for a long time. And I started in the Medicare space. Initially, I was in the P&C space, and then started in the Medicare space in 1997 with Humana. So like 27 years. I think it was 27 years, 28 years. Started with Humana in sales. I live here in Tampa, and was a sales agent for Humana for several years. Did very well. Was a number one agent in the country 2 years in a row. Had one AEP, which is the Medicare enrollment period, which is starting next week, October 15th. I had one AEP where I did 680 enrollments during that time frame, and that was like number one in the country. And because of that success, I got promoted to sales manager in 2001. I got promoted the second time to a national sales manager in 2005, when at the time Humana was only in 6 states, and our sales leader had the vision of taking Humana from regional to national with the advent of Medicare Part D, which was in 2006. He thought that was a good opportunity for us to launch and grow and be a presence in 50 states, and we did. So I got promoted to national sales manager in 2005. I was in that role from 05 to 08 and traveled the country, recruited agents, trained over 10,000 agents in a face-to-face setting for those 3.5 years. That was required back then, was a face-to-face training. Today you can do it virtual. Again, dating myself. And it was really a great experience for me. I gave most of the largest IMOs and FMOs in our business their Humana contracts back in those days. So I made a lot of relationships, met a lot of great people, business owners, entrepreneurs, learned a lot from them. In 2008, I decided to take a position with Humana as a state director of Georgia. Just got really tired of all the travel it was like I was diamond with Delta like 3 years in a row because I was traveling so much. And, missing too many events with my family and stuff. So took a position as state director, moved to Atlanta in Georgia in 2008. I stayed with Humana until late 2010 and saw a gap and recognized a gap in the market as it related to what's called value-based care, which is a healthcare delivery model specifically for Medicare Advantage members and beneficiaries, and really was prevalent in the state of Florida, which I grew up in the industry in, and it wasn't in Atlanta. I saw that gap and I left Humana, partnered with a value-based care group from Florida. We launched in Atlanta. We had 9 medical practices in the Atlanta market, and we ran that from 2010. We sold it in 2016. Then I spent 2000, and I learned a lot with that too. Learned a lot about just profiling patients, closing gaps, promoting preventive medicine. And we sold that in 2016. In 2017, I just did some consulting work. Then I joined Heartland Financial Group in your backyard there in Blue Springs, Missouri.
Yeah.
Was hired to launch their Medicare vertical. And we quickly grew that to equate to 40% of the annual revenue. Took it from zero to over 40,000 sales a year. And then Heartland sold to Integrity Marketing Group in late 2022. I stayed on till 2020 I stayed on and I resigned from Heartland in early 2024. I stayed on till the end of the OEP. I left there in March and started my own agency called Care Connect Agency here in Florida. I moved back to Florida in 2020 and started my agency in 2024. And we have agents in 14 states right now.
Amazing.
Yeah, it's a lot.
All right.
No, that's fantastic.
Thanks for giving us the full picture, because as you were rattling this off, before we even started, I was telling you, this is something that I don't know a lot about. So I'm going to ask, like, if you were to describe who is Medicare for, when is the open enrollment period, and what does kind of that like initial conversation sound like? Let's start right there. Let's start at the very basic of like, this is who you're talking to, this is the time frame that you're talking to them, and this is who qualifies.
Yeah, sure. So Medicare is a federal program for Americans that are over the age of 65. So it starts when you're 65. And if you're under 65 and you have like a disability, you can qualify for that as well. But mainly 95% of the people that have Medicare are 65 or older. It's a federal health program, and it covers your hospital benefits, your physician benefits, but there's gaps. So because of the gaps that exist in the Medicare benefits from the federal government, there's a need to supplement that. So then there's options. You can have a Medicare supplement plan that you pay for. You have a premium. Those are offered by private insurance companies like Mutual of Omaha is a huge provider of that. United American, United Healthcare with their AARP plan. And then another alternative option is the Medicare Advantage, which Humana is a big player in the Medicare Advantage space. And like I said earlier, like, it was really prevalent here in Florida, and Humana was like a regional company for years because there's a lot of seniors here in Florida, also offered in Texas, a lot of seniors in Texas, but now it's nationwide. I mean, there's Medicare Advantage plans offered in all 50 states. And, when I started in the business, probably about 5% of Medicare beneficiaries had a Medicare Advantage plan. Today, it's over 50%. So it's grown that significantly. So Medicare, who it's for, consumers or Americans 65 and older. If you're under 65, you can qualify for Medicare disability. Med Advantage is an option. Med Sup's a different option. And then Medicare by itself is really not really a good option. You have too much risk. You leave yourself exposed with too much risk. And the enrollment periods are now. It's actually now October 15th starts the enrollment. So it's called annual enrollment period. So during that time frame from October 15th through December 7th, everyone in the country that has Medicare can choose their Medicare Advantage plan. And when they make that decision, that choice, the plan is effective on January 1st. So those plans are filed every year. The Medicare Advantage providers, they have to submit their benefits to CMS for approval, and then Centers for Medicare and Medicaid Services, that's who CMS is. They have all the oversight for Medicare Advantage, all marketing, sales, plan design, all of that. So they plans have to submit those every year, and they're approved every year, and they only run for a calendar year. So they change year to year. So during October 15th through December 7th, that's like the shopping time called annual enrollment period for consumers. They can compare their plans, make sure there's no changes to their plans, because most of those are they're all network driven plans.
Yep.
So providers can go in or out of network. So those decisions are made. Those plans start January 1st. That's called annual enrollment. From January 1st through March 31st, that's called open enrollment. So that's 90 days. And during those 90 days, consumers can make one change. So they make their annual change in the first enrollment period. In the next 90 days, they can make one more change. If they decide in the first 90 days of the year that the plan they chose wasn't the right plan, they can make a change. They only have one opportunity to do that. After that, they can't make a change unless they have like a life-changing event, like they lose their job. So,
all right, question. Because there's always a debate in the insurance industry, Medicare Advantage versus Med Sups. So talk to us a little bit about like customers that you find better solution as a Medicare Advantage versus the Med Sups.
I think that, and that's a great question, right? And there's a huge debate, because I think there's two camps. And I had this conversation a lot. I had it just with someone late last week. I can't remember who it was, but Med Sup versus Med Advantage, and agents that sell brokers and agents that sell Med Sup, they're like, I'm Med Sup, and I'm not going to sell Med Advantage. I'm never going to sell it. Agents that sell Med Advantage, like, this is what I sell. I have no interest in doing. I do both. I actually do both.
Okay. Okay.
Yeah, and because I think it's important to do both, and I think that to your question, the way you coined or phrased your question there, you asked it the right way. Like, who's it right for, right? Like, who is there a different profile? I think that today, in today's world, because of all, the cost of everything is so much more today than it was 5 years ago, 3 years ago, right? 5 years ago, for sure. So I think it's really financially driven today. I think that consumers that can afford a Med Sup, because Med Sup, as you get older, it's gonna increase. You buy a Med Sup plan when you turn 65, and you can get it for $100 a month. By the time you're 72, you're paying $220 a month, right? It's going to go up because everything goes up. So if you have the financial means to do that, the benefits of Med Sup versus Med Advantage, I mentioned that with Medicare Advantage, they're all network driven. So the benefit with Med Sup is that you pay your monthly premium, and then when you go to the doctor, you show them your Medicare card, you give your Med Sup plan, you pay nothing else. There's no additional out of pocket, and you can go to any provider in the country that accepts Medicare. With Med Advantage, you're restricted to a service area. So the service area is typically the county or the 4 or 5 counties you live in. So you're restricted to service and to seeing providers within that county, and then also within that network. If you're on an HMO plan or it's a PPO plan, so you have that restriction. But with Med Advantage, you don't pay any monthly premium. You pay your Medicare Part B premium, which is $185. You pay nothing else above that. And that $185 comes out of your Social Security check. So consumers really don't see it or really feel it. You pay the Part B, whether you have Med Sup or Med Advantage. But with Med Advantage, you don't pay an additional premium. There's no monthly premium. But when you go to the doctor, there's copays. So you're limited on your doctor selection. And then you pay a copay when you go to the doctor. Most of them are like, if you go to your family doctor, there's no copay. It's like specialist outpatient surgeries. And then with Med Advantage, the reason it's gained in popularity so much and grown so fast is because of the zero premium, but then also the added benefits. They give you dental benefit, vision benefit, hearing benefit. And then there's a lot of plans that are designed for, again, getting back to the financial reason. There's a lot of plans designed for consumers that have both Medicare and Medicaid, which are called dual special needs plans. And they have even extra benefits above vision, hearing, dental. They have like a food card, like they'll have like a debit card they can use for groceries, and other things, over the counter things as well. So yeah.
So let me just.
I want to clarify the 185. Is the 185 annually? Is it monthly?
Monthly, yeah, monthly. Yeah.
Everybody has to pay that.
Okay.
Everyone pays it, unless you're really low income. If you are below the financial poverty level, if you're below that, then they waive the 185.
Okay.
Yeah.
Okay. So my question would be, so Med Sups, you pay a monthly premium. If you have the top tier Med Sup, you pay your Medicare cost, you pay your Med Sup costs. Anything ever happens, you're not responsible for anything out of pocket. I want to talk worst case scenario on a Med Advantage because I honestly don't know this answer. So let's say that you went to the doctor, something was wrong with your heart, you had to have $100,000 surgery. How much out of pocket could someone on a Med Advantage, so Med Sup 100% covered, Med Advantage, what is total out of pocket on something like that going to be on average?
Yeah, another great question, right? So, and the answer is it's going to depend on the plan that you have. So with an HMO plan, you have a smaller network. With a PPO plan, you have a larger network. And if you choose a PPO plan, you can go out of network. If you're a Medicare Advantage member and you have a PPO, you can go out of network. Like let's say you wanted to go to the Mayo Clinic. You can do that, but you're going to have to pay 20% of the overall cost. If you stay in network, you're gonna pay your copay, and again, it depends on the procedure that you're getting done. Like if you stay in network and you're having chemotherapy, you still pay 20% of the cost, right? If you're having open heart surgery, you don't pay. You just pay your hospital copay in that scenario. And the hospital copays they're going to range too. And the hospital copays on all the plans, HMO or PPO, they have like a daily cost, like $450 a day for 5 days. Then at 5 days, then you're capped. But with all the Medicare Advantage plans, whether it's HMO or PPO, they do have what's called an out of network or annual MOOP, maximum out of pocket. That's what they have. That's what maximum out of pocket expense. So they have that limit on, and when you get to that, then above that you're covered 100%. And then that really depends on the plan you have, HMO versus PPO, and then really the market that you're in. Like in Florida, the maximum out of pockets are lower, like 3,400. In Missouri, they might be 8,000. And that's because the reimbursement that the insurance companies get for enrolling people on their plans is different in Florida than it is in Missouri.
Okay.
It's different. Go ahead.
Okay, so if there's a max out of pocket, that means even with like the chemo example you gave,
Yes.
the most you'd ever pay out of pocket is the $3,400 that you just said, and then anything on top of that you don't pay.
That's right.
Okay.
Yeah. When you reach that, you're covered.
Okay.
So I want to talk a little bit about the 65. So my birthday's in January. So I will turn, obviously when it's my turn, I will turn 65 in January. When should I start thinking about having...
You look really great at 65 right now.
How do you do it?
I know. Yeah, I'm actually 82.
So what you're asking is you were turning 65?
If I were turning 65 in January, because I'm trying to figure out is when do we need to start having these conversations so that we're prepared when we're 65?
From like a prospecting method
Yep.
for... Okay,
Exactly.
perfect.
Yeah. And then you guys are asking really good questions. And I mentioned earlier, I do both. I do MedSup and Med Advantage. That's because I market to consumers that are turning 65. So my marketing approach, I have a drip marketing campaign that starts 6 months before people turn 65. So I'll mail the same consumers over and over again for 6 consecutive months with a different marketing piece and call to action. Month away, 5 months away, 4 months away, 3 months away, 2 months away. They can't enroll into a plan. So it's called the initial coverage election period, ICEP, initial coverage election period. That starts 3 months before you turn 65. It's also the month that you turn 65 and then last 3 months. So during that 7-month window, you have an opportunity to choose whatever plan you want, whether it's Med Advantage or MedSup. And if you choose Medicare Supplement during that time frame, you have what's called guaranteed issue, meaning that because you're turning 65 and you're starting your Medicare benefits, the insurance company can't turn you down because of risk or your health conditions. They have to accept you and have to give you a plan. So you have that guaranteed issue on MedSup. And then with Med Advantage, if you're turning 65 in January, you could actually enroll in like October, but then your benefits won't start until January 1. It starts the first day of the month you turn 65.
Okay. So do you find that your customers have already made their decision prior to their 65th birthday?
Most. Okay. And, it's funny because I market to that demographic, to the people turning 65, and most of them that I talk to, it's like they get bombarded with mail, phone calls, like they are getting hammered because it's funny because some people they're sarcastic about it. It's like, hey, no one cared when I was turning 64, but man, I'm turning 65. Everybody's telling you stuff.
Well, for sure. It's time.
Yeah, exactly.
Okay. So, talk me through a little bit. When somebody comes to you, what are the questions that you are getting asked most frequently that you have to answer?
So it's so different today because again, when I first started in the business, people that are turning 65, I mean, honestly, I'm talking about 1997, like less than 5% of people turning 65 back then were working. Today, it's over 50%. So one of the questions I get is, how do I get my Medicare card? And most people back then, turning 65, they were already collecting their Social Security benefit. If you're getting Social Security, you automatically get your Medicare card in the mail because you apply for it through the Social Security Administration, right? Because it's a federal program. So I get that question like, how do I get my Medicare card? Do I need to apply for my Medicare benefits? And if they're still working, they're going to apply still. But if they're still working, they're covered on a group plan. They really don't need to start their Part B and pay the monthly premium on the Medicare Part B because they have what's called credible coverage through their work. So I get that question a lot, like how do I sign up for Medicare? How do I apply for it? And then a question I get a lot now too, because over 50% are still working. Do I need to start my Medicare? Do I have to get Medicare if I'm still working? insurance through work? And and that question is, we have to sit down and go through like a needs analysis.
Agents, you no longer have to choose between training your team and growing your business. I want to introduce you to Agency Coach AI. This is a full-time 24/7 coach and trainer at you and your team's fingertips that reports directly to you or the sales manager. This thing is amazing. Just like a true sales trainer or coach, it is going to practice and role play with your team, each individual, every single day. It's then going to coach them after that practice session. It's going to recommend trainings if they need additional training. And then it's going to report directly to you or the sales manager on exactly how that practice session went. No more wondering if the team is practicing or if they're not practicing. Also, it's going to plug right into the live sales calls. It's going to listen to every single conversation that comes into the office or goes out of the office every single day. No more wondering what is happening on the sales conversations. It's going to be documented for you word for word. And then the coach and trainer is going to coach your team on what they did well, what they could have improved on, recommended trainings, and it's going to give you a detailed report on exactly what that team member said during the call, what they were coached on, and what training was recommended. This is just the beginning. There is so much more to this. So if you are ready to have more transparency and more accountability in your agency than ever before, if you're ready to have your time back, if you're ready to know what's happening in your agency, regardless if you're there or not, this is now a reality. I would tell you, in my opinion, this is going to be one of the most valuable tools, if not most valuable tool you've ever had the opportunity to invest in. And it is one of a kind. It is unique. Nothing like this is currently available for insurance professionals like you. So please go to agencycoachai.com or just shoot me a text, 816-727-7610, and let's get a time on the calendar. I promise you it will be worth your time. Other than that, let's get back to the episode.
We need to do that, because again, when I started years ago, most of the time it was the right decision was to stay in your group plan because it was a lot more affordable without less out of pocket. But today, you might be paying $800 a month for your group insurance and still have a $1,500 deductible and other out of pockets, right? So it's like, hey, let's sit down and compare. Let's do a Ben Franklin. This is what your group insurance covers, and you could go on a zero premium Medicare Advantage plan if you want to do that, because you can not start your Part B, so you save $185 a month, but then what is your group insurance cost and what's your deductible? So you got to go through all that.
Wow. Okay. So 50% of 65-year-olds that you were talking to are still working.
Yeah, over.
Okay.
It's crazy. It's crazy. I mean, but that's the times we're in, right? I mean, it's just, people can't survive on just their Social Security benefit.
For sure.
So that's what I know nothing. This has nothing to do with the Medicare conversation, but what are most people working just because they don't have enough investments saved and things like that to be able to support their lifestyle? Is that what you're finding through conversations?
That's it. Yeah, they can't afford, again, crazy, how times change. But again, back when I first started, there was a lot of people I spoke to that had a pension. They had a pension from their employer. I worked in the same business, same company for 30 years. I have a pension now. They don't today. Yep. Unless they were a retired teacher or state worker or city worker, like that, something like that. They work for like a municipality or something. It's just most of the back in the day, it was like people that worked for GE or GM or those companies for years had a pension, and today it just doesn't exist. So times are different, and people are just having to work longer.
Yeah. So talk a little bit about, since price is so important, what does that conversation sound like when you're sitting down with somebody to really find out what's important to them? Because if price is looming over their head and they're like, I can't even retire yet, like I'm still living, paycheck to paycheck. Talk to me a little bit about some key questions that you're asking in that conversation.
Because it's kind of a double-edged sword. Like, it's one thing to live paycheck to paycheck, but at the same time, you don't have enough money saved up to be able to afford the potential copay. So yeah, I'm very interested what questions you're asking to determine
which
like an advantage versus a sup.
Yeah.
Yeah. So for me, and it is a different conversation. So when if they're already on Medicare, because even though I market to the people turning 65, I still sit down and talk to a lot of people that are already on Medicare and already have a plan. So with those consumers, the conversation is like, what plan do you have now? And let's start there. What do you like about the plan you have? What don't you like about the plan that you have? And then I always make sure that if there's anyone that helps them with their healthcare decisions, like do they have their spouse, do they have a child that helps them with their Medicare, with their health plan choices, gathering all that first. That's first and foremost. Those are critical questions and answers that I need answers to identify, to have a starting point. And then from there, going into what doctors do they see? Do you have any kind of chronic disease? Do you have diabetes? Do you have any kind of heart disease? Any kind of chronic disease, COPD, heart disease, diabetes, because those are important because then that tells them what kind of medications that they would be on. And then we have to check the medications because with Medicare Advantage and we talked earlier about MedSup and Med Advantage. With either one, there's a Part D. There's a drug benefit. So that's what I mentioned at the beginning. Like when our leader at Humana had the vision of going to 50 states with the Abbott and Medicare Part D, which is in 2006. So Part D is a drug benefit, right? So if you have a MedSup, you still have to buy a Medicare Part D. Most of the Medicare Advantage plans, it has embedded into them a Part D benefit. So there's a drug benefit. So with either option, whether I'm selling a Part D plan with a MedSup or a Medicare Advantage plan with an embedded Part D, I still have to look at their drugs and research their drugs to find out what their drug costs would be within a particular plan. Because there's different tiers. If they're generics, most of the drug plans are going to cover generics for like zero copay. If they're brand names, they could pay $45 a month. They could pay $100 a month. And that just depends on like the formulary. So we're getting into that. So the questions I'm asking are what plan do you have now? What do you like? What don't you like? Who are your doctors? What medications you're on? Do you have any chronic diseases? Because one of the things, my agency is called Care Connect Advisors, and I put the term advisors in there because I really look at us as advisor. Like I'm not a salesperson. I'm here to educate you. I want to educate you. I want to sit down with you. I want to take time. I mean, my appointments are an hour and a half. And if they're new to Medicare, sometimes it's 2 hours. And it's a thorough needs analysis. It's a thorough health risk assessment, identifying their chronic disease and conditions. And then there's an education part about value-based care. And I mentioned value-based care before as well. I was a managing partner in a value-based care organization for 6 years. And value-based care providers, they specialize in helping Medicare beneficiaries that are on Medicare Advantage plans manage their chronic diseases. And like when we had our value-based care clinics, we saw our patients, we profiled our patients and put them into one of 4 different quadrants. And then the quadrants determined like how frequently we would see them, every 30 days, every 60 days, every 90 days, or every 6 months. And obviously we want to get everyone to every 6 months. But if they're a diabetic patient, their A1C is 9, it's like you are not taking your medication, or your diet's not right, or something is throwing off your A1C, and we have to manage that. We want to get it below 6, and then we want to bring you in every 6 months. So, and I do that today still with when I'm asking those questions. I go through health risk assessment, identify that, and I talk and educate them about value-based care and how that model is really different than the traditional like fee-for-service model, right? I spend a lot of time educating consumers and making sure, and that's why I call it Care Connect as well, because we care about you. We want to connect you with the right health plan and the right provider group, and we're going to advise you on that. And a lot of times, the people that I sit down with that are already on a plan, they're on the right plan, and I'll let them know that.
Okay, that's great. I'm going to actually circle back around real fast to the prospecting. So you said you had a 6-month drip campaign. Are you finding the most effective marketing campaign? You've been doing this for a while now. So are you still doing direct mail campaigns? Are you doing email campaigns? Are you doing calling campaigns? Are you doing a mix of all 3?
A mix of all 3. Or all
mix
3,
of
yeah.
all 3.
Yeah.
Okay.
So the drip
and that's
marketing,
part of that 6-month drip campaign?
Mm-hmm. So the drip is it's mail, direct mail.
Okay.
So we have like a brochure that goes out that talks about our agency. And again, it's a different piece. Every month it's different. The first piece we send out is like a newsletter. It's a newsletter. It talks about like, here's like frequently asked questions when you turn 65 about Medicare and how you start Medicare. And the next one's a brochure that has some other frequently asked questions, but then it also brands our agency and whoever the local agent is. Here's who we are. Here's what we've done. Here's what we have done. Here's what we do. Talk about value-based care in there, a lot about value-based care. And then the next 4 pieces are postcards with a call to action. And all of them have a QR code that they can scan and go to our landing page.
Yeah.
And at the landing page, they can watch a video. It's a 30-minute presentation on the difference between Med Advantage and Med Sup. It also has a picture of like the local agent with the, picture and their profile and like who we are and what we do. And again, talks about value-based care a lot there on the landing page.
Okay, out of curiosity, because I bet you have the statistics, I know elders love mail, so this is perfect. But how many are actually clicking? Like, what statistics of people actually do the QR code? Is it pretty high?
No, it's not. It is. It actually is when they get closer. As they get closer, turning 65, and then Courtney, you asked if they've already made up their mind. Like a lot of them have through some research. But as they get closer to that time when they have to make that choice, the clicks do happen more often. And just to be honest, like when I launched my I ran that campaign when I was at Heartland Financial Group. And then when I launched my agency, I launched the agency a little over a year ago. And the first year and 14 months, I really spent a lot of time and focus on growing a direct-to-consumer calls, virtual sales team. So I had 28 people on the phone selling, and I spent a lot of time, being by myself. I couldn't really do both because, I hired like 51 agents in like 4 months, and then I ended up with like 22, and then I grew it back to 28 and up and down. I was like, this managing people is tough.
Yeah. Everyone listening is like, yes.
Yeah. So I really, so my point is I really just launched the T65 campaign again for the second time in my career. I launched that again about 5 months ago. So I don't have, as they get closer, they do click more often. But I know your initial question was, do we do all three? So the mail is like I described. Then we have, and I have a marketing firm that I work with that manages my website and manages all of it for me. So they track all that for me and have a dashboard and gives me all the metrics. But right now I'm actually meeting with them tomorrow and starting the next 6-month campaign to 5,000 new consumers. That's who we'll hit over those 6 months. And with that, as we're marketing them and doing direct mail, we're also approaching the same consumers through Facebook or Instagram, mainly Facebook. That demographic, they're really not on Instagram, they're not on TikTok, but they're on Facebook. So we do a lot of Facebook campaigns and ads and the Facebook stuff also includes the QR code as well.
So let's talk a little bit about, because you're getting into my lane of like demos, like who's the demographic? Like who are you targeting? Like what's the age group? Is there a certain income level? Is there certain interest? Because all of this on Facebook. So at what point do you start targeting? What age are they? And what point do you stop targeting them? Like what's the sweet spot on age and income?
So for that particular campaign, and that's the only, and I need to expand it, but that's the only social media campaign I have right now, and that's the people that are turning 65. So it starts when they're like 64 and a half. Okay. It starts there. And I really, and that's a great question, Courtney, because even like asking that question and then answering, it's like, for me, it's like identifies, one of my areas of weakness. I need to improve myself personally as a business owner and a leader. I need to get better at understanding all of that, the social media marketing landscape and world. Like I don't. And I actually have been looking into that. Like Go High Level offers a lot of like training on that. That's a platform. And you guys are shaking your head. You're familiar with Go High Level?
Yeah.
So we've heard of Go High Level for sure.
I'm shaking my head because I would tell you my instinct says hire somebody that knows that.
Yeah.
Stick to, and this is, I'm always an advocate for this. You as the as the advisor should always stick in the advisor role and let
Yes.
marketing firms and agencies and people who study trends and data, because it might look a certain way today and tomorrow Meta can change everything and it's a
That's
whole different
right.
game.
Yeah.
So I'm just asking this for somebody who's, just kind of, they might not be running ads, but even like if they're calling their current book
target
of
book of
business,
business, yeah.
yeah, they're looking at, okay, so in my book of business, I have this amount of households. I'm really concerned with, is there a certain income level or is there a certain age range where it's like, let's narrow down this list. And even if you're just banging out, calls,
And
like
when-
who am I talking to?
And when do you
Yeah.
stop
Sure.
marketing?
Yeah, when do you stop?
That's a great question. So 64 and a half is when you're starting to try to market, maybe even before, maybe age 64 for some of our so we work with a lot of PNC agents that have books of businesses. So maybe they start the marketing cycle on when they turn 64 just to start some of that education. When are you stopping the marketing cycle? Do you continue to market through their 60s, or what does that even look like?
Yeah. Again, you guys are asking great questions. So, and to answer that more precisely, so the turning 65 campaign starts at 64 and a half. Obviously it stops when they turn 65 in 3 months. We stop at then. But in the past, and I mentioned, there's consumers that qualify. They have Medicare and Medicaid. They qualify for what's called dual special needs plans, and those have more benefits. So when I was at Heartland, and I was there for 6 years, so we did a lot. We were spending a couple $1 million a year on like direct mail when I was at Heartland. I was the VP of the national VP of sales. We were doing, 40,000 sales a year, but we spend a lot too. And we segmented it. So we had the 64 and a half to 65 and 3 month campaign. We had consumers 65 and older that were making less than $15,000 a year. Well, we not 65 and over, 65 to 76.
Okay.
And less than $15,000 a year of income. And then, and we also, with those campaigns, we limited them to areas that we know there was dual special need plans available and had really strong value proposition. And I would tell you, like, it's crazy because we started that in like 2019. And when we first launched that low income one, we were getting like 8% return on mail, which is, crazy, 7-8%. If you talk to, agents or agencies that are doing direct mail today, it's like, if you're getting 2%, you're like thrilled,
Yeah.
it's like 1%'s the norm.
Yeah.
I mean, we were killing it. And then, then I think when COVID happened, COVID really changed like a lot. It changed from a marketing standpoint in our industry. And it really started to take on more direct to consumer through social media and phone. I mean, I read an article, I don't know, January or February of this year that said, the last annual enrollment period, October 15th through December 7th, that over 70% of enrollments were done over the phone, last AEP, which is crazy to me. Wow. It's my, and whether that statistic is right or not, even if it's over 65%, it's a huge number. So yeah, it's just, we've segmented. We have the turning 65 campaign. We have the low income campaign. And then we have the campaign for people that are 20,000 to 50,000, which is really going to be our kind of like our traditional Medicare Advantage HMO client. And then 50,000 and above is really going to be like a med sub client. That's going to be the med sub.
Perfect.
Right?
Okay.
Yeah,
that's great.
That's a perfect breakdown, because I think at least when I'm talking to agents and even consumers, most consumers don't know what all of these different carriers offer. They have no idea that your different agents can even offer these kind of plans. So I think starting some kind of awareness campaign. I'm curious though.
Just one second.
Go
I
ahead.
don't mean to cut you off. So you just said less than 15,000, 20 to 50, and then 50 plus.
Yeah, 50 plus.
Perfect.
Yeah.
Perfect.
Yeah.
Okay. Sorry.
Your appointments, you're doing them Zoom, on the phone. Are you doing any in-person appointments, or is everyone comfortable with Zoom and on the phone? You said 65% on the phone.
Yeah,
but
so
I'm
we don't
curious.
do any Zoom. We do over the phone. We have a team that's on virtual. I call them virtual over the phone. That's why I name my virtual, because they're also, most of them are remote. We have brick and mortar, but brick and mortar we only have 8 agents brick and mortar, and the other 20 are remote. That's my virtual sales team. Everything else is face to face. We have another 130 brokers that are all in the field, and they're all face to face. They all do face to face. And one thing that we do that not a lot of other agencies do. And I had a call this morning with one of my agents in Chicago that had his event over the weekend. So with Medicare Advantage, I mentioned earlier, like the plans change every year, right? So the carriers that offer those plans, they're required to send out in September every year. They're required to send out what's called an annual notice of change notice to consumers. Here's the changes of your plan. You're on this plan in 2025. In 2026, here's how your current plan is going to change. The copay might go up. This provider group might not be available anymore. This particular drug might go from tier 1 to tier 2. Like all that, whatever changes are going to happen, they're required to send that annual notice of change letter out in September. A lot of consumers throw it away. They don't really even understand or know what it is. They're like, I don't know what this is. They ignore it. It just ends up on their table or desk. So we always advocate to our agents that work with us is to run your events, like run a annual notice of change event, invite your clients to come, have coffee and donuts, make it fun, have some door prizes, have a little entertainment. And I was talking to an agent this morning that did his on Saturday in Chicago, and what he did was he had a shredding event. So he had all of his current clients, and he has like 750 clients. He's like, save up all your shredding for the year, like your important documents that you just want to shred and you don't have a shredder at home, put them in a box, bring it to my event. We're going to shred them for you. And we're going to take 30 minutes to sit down and go over the changes of your benefits for the coming year. And he had like 3 different tables set up. If you have Humana, go to this table. If you have United, go to this table. If you have Anthem, go to this table. And he had a couple other agents there with him. They went through the notice of change. They had coffee and donuts. And he had like 500 people show up. And he ran it from 10 o'clock to 2 o'clock. Yeah. And he rented out a space at this shredded office. They had like space in the back, and he rented it out. Yeah. And he's like, people were excited. Isn't that great?
I love this. Okay, yeah. September is such a good month because September is also Life Insurance Awareness Month, and September is when all of these renewal notices go out. So it's like, if you're not talking about future planning, September is the month to be doing it. And I love that we're currently in open enrollment. We're going to rush this podcast episode out so we can get it out so you listening can take. Neil, this has been incredible. Like, I have a full page of notes really going over a lot of information that I didn't understand about Medicare. And I think the biggest thing with whatever plan we're talking about, you as the insurance professional really needs to start creating some kind of awareness campaign about this is something that I offer and this is who it's for and this is the time frame when you're eligible. I love this. Neil, you have given me so much information when I do turn 65 in the years to come. Thank you so much for sharing that.
Well, Neil, if somebody wanted to maybe reach out, they had more questions, maybe they're looking for an opportunity to get into the Medicare space and help customers with Medicare, what would be the easiest way for them to connect with you?
Yeah, our website is careconnectagency.com. So agents can go there. They can connect with me. I have my whole team on there. If you scroll down, I have my whole team there. You can connect directly with me. Just click on the Connect with Neil button, and they can connect me with email or phone call. And there's also a place on there that they can click on and request information. So we have what's called our playbook. So agents, like when I'm recruiting agents, one of the things that I do, it's different from most of the marketing entities, like I mentioned, Heartland, a Heartland or an Integrity or these large marketing. They'll go out and just recruit thousands of agents. They have, when I was at Heartland, we had 80,000 agents in our database. I have like 140, and I do that on purpose. But I limit the number of agents that we work to within a certain market. It's obviously depending on the size of the market. Like here in the Tampa Bay area, the capacity for us is 8 agents. That's it, because that's the number of agents I think I can deliver value to, right? And share my playbook and share marketing ideas and strategies, like the Come Shredded event. Like those are things that we do, like not a lot of others are doing. And doing this for 27 years, I've learned a lot. I've been really fortunate to like work with a lot of great mentors and pioneers of our industry. And Humana does and I think probably the best job in the industry at investing in the development of their people through training. I think that in business, I think the 2 main pillars of training are leadership and training, or business are leadership and training. And Humana does a great job of training. I learned so much there. And my 27 years experience, I share the things I've learned with our agents. So we limit the number of agents we have in each market so they can have, direct access to me and my other sales leaders and get one-on-one training and guidance from us.
I love that. This has been so good.
Yeah, this has been really good. Neil, thank you again for your time today. This has been very informational, very educational. I know a lot of listeners right now are mind blown right now, and they're like, okay, we are...
Time to get to work.
Yeah, time to get to work. So,
Yeah.
Neil, thank you so much. For those of you who joined us today, as always, time and attention are by far our most important assets. We always appreciate you very much for tuning in and joining us on The Buzz. With that being said, go out, change some lives, contact some 65-year-olds, and help them out with some Medicare. So other than that, Neil, thank you again. Appreciate you guys. Go out and make it great.